Imagine this for a moment. You're sitting quietly at the end of a long day. Nothing seems wrong. But suddenly, there it is. That uncomfortable, crawling sensation on your skin. You scratch, and for a second it feels better. Then it comes back, stronger, again and again. If you've ever dealt with persistent itching, you know how exhausting it can be. Not just on your skin, but on your mind. Today, we're going to talk about itchy skin, what doctors call pruritus, why it happens when it's harmless, and when your body might be asking for deeper attention. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP, UK, medicine specialist, diabetes and hormone specialist. The information has been collected from Mayo Clinic, Cleveland Clinic, NHS UK, and other trusted medical sources. Before we begin, don't forget to subscribe to this channel for more simple, science-based, doctor-reviewed health videos that help you understand your body better every day. Now let's start gently. Itchy skin is that irritating urge to scratch, sometimes mild, sometimes intense, sometimes so persistent it disrupts sleep, focus, and peace of mind. For many people, especially as we grow older, the most common cause is simply dry skin. As we age, our skin naturally loses moisture and protective oils, making it more sensitive and reactive. Sometimes the skin looks completely normal. No rash, no redness, nothing obvious. Other times, you may notice rough patches, tiny bumps, cracked skin, or areas that look inflamed. And when scratching becomes frequent, the skin can thicken, darken, even bleed, increasing the risk of infection. This creates what doctors call the itch-scratch cycle. The more you scratch, the itch intensifies. The more it itches, the harder it is not to scratch. Now let's understand where itching really comes from. In many cases, it starts on the surface. Skin conditions like eczema, psoriasis, hives, insect bites, scabies, or simple dryness can trigger itching. Even healing scars or burns can itch as nerves regenerate. But sometimes, itchy skin is not just a skin problem. When itching affects large areas or the entire body, without an obvious rash, it can be a signal from inside. Conditions involving the liver, kidneys, thyroid, blood, or blood sugar can all show up as unexplained itching. Anemia, diabetes, thyroid imbalance, and even certain cancers may sometimes present this way. There are also nerve-related causes. Problems like shingles, pinched nerves, or neurological conditions can create itch signals without visible skin changes. And then there's the mind-body connection. Anxiety, depression, and obsessive thought patterns can amplify itch perception. Stress doesn't cause itching out of nowhere, but it can turn the volume way up. Sometimes, despite careful testing, no clear cause is found. And that, too, is more common than people realize. So when should you stop brushing it off? If itching lasts more than 2 weeks and doesn't improve with moisturizers or gentle care, if it's severe enough to interrupt sleep or daily life, if it starts suddenly, spreads all over the body, or comes with weight loss, fever, or night sweats, that's when it's time to see a doctor. If itching continues for 3 months or more, a dermatologist, and sometimes an internal medicine specialist, may need to look deeper with blood tests or imaging to rule out hidden conditions. Now let's talk about relief, because itching is treatable. Treatment always starts with addressing the cause. For many people, simple changes make a huge difference. Daily moisturizing is essential, especially with thick, fragrance-free creams or ointments. Gentle cleansers, instead of harsh soaps, protect the skin's barrier. Short, lukewarm baths soothe better than hot showers, which actually worsen dryness. When inflammation is present, doctors may prescribe medicated creams like corticosteroids or other anti-inflammatory treatments. In some cases, applying medication to damp skin and covering it helps lock in moisture and improve absorption. For long-standing or severe itching, oral medications may be used, including certain antidepressants that calm itch pathways in the brain over time. Light therapy, called phototherapy, can also help when other treatments aren't suitable. At home, small habits matter more than you think. Avoid fabrics, products, or environments that trigger itching. Wool, strong detergents, excessive heat. Keep nails trimmed to reduce skin damage if scratching happens unconsciously. Use soothing creams with ingredients like menthol, camphor, or pramoxine for temporary relief. A humidifier can help if dry indoor air is making things worse, and don't underestimate rest and stress management. Poor sleep and chronic stress can lower your itch threshold, making everything feel worse than it actually is. Here's the most important takeaway. Itchy skin is common, but it's not something you have to silently endure. Sometimes it's a surface issue. Sometimes it's a deeper signal. And sometimes it's your body asking for gentler care and closer attention. Listening early can prevent months of frustration later. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP, UK, medicine specialist, diabetes and hormone specialist. Information collected from Mayo Clinic, Cleveland Clinic, and NHS UK. If you found this video helpful, please subscribe and share it, because awareness is the first step to healing.